Malaysia is ahead of schedule in its vaccine rollout. With over 480,000 people vaccinated, Kari Jamaluddin said Phase 2 of the National Immunisation Programme would begin earlier than expected. Azrul Khalib, CEO of Galen Centre for Health and Social Policy, says the real test of the vaccination drive is the second phase. What are some of the key challenges and how do we continue to address vaccine hesitancy among the public?
The second phase of the National COVID-19 Immunisation Programme begins from April to August and will involve a total of 9.4 million. They are senior citizens aged 65 and above, high-risk groups such as those with chronic diseases, as well as people with disabilities.
Vaccine hesitancy is going to be featuring large amongst the second phase group of people, especially since a lot of them are classified as vulnerable populations who need to be protected. These are predominantly people with coexisting conditions, comorbidities such as living with diabetes, cancer, hypertension, chronic kidney disease, and different illnesses that basically make them, uniquely qualified to be in second phase. So there's going to be a lot of hesitancy in this group of people because they're already living with a condition, a medical condition, which maybe they feel could interact with the vaccine that they're going to be receiving. But having said that, though, I think what we're going to see here in the key concerns for the second phase may not have really much to do with the vaccine hesitancy itself, but more towards the issues that we are looking at from a logistics as well as pragmatic perspective. The first key concern for the second phase is going to be whether we will have enough vaccine supply for this first phase. I know the government has indicated clearly that it has secured enough of the Pfizer-BioNTech vaccine for 70% of the population, or at least has secured at least for 51%, another additional 20% for the population. So it'll be good to know whether this delivery schedule that has been made known is actually being kept to, so that we're going to continuously be able to have the supply of vaccine for us to be able to vaccinate as many people as possible.
Besides vaccine hesitancy and logical issues, Azrul highlighted the need for Malaysians to be registered as soon as possible.
Another issue here is really when you look at the data coming out from the MySejahtera as well as the JKVAV registration efforts for the vaccination rollout, you find that actually out of the 4 million people who have been registered, well, now it's, I think, 6.4 million people that have registered under the MySejahtera application. You find that actually around 1.6, 1.7 million people out of that number qualified to be under phase 2. So we're asking the questions like, where are these people? Why are they not coming forward to register under MySejahtera? Are we going to end up missing a lot of people who are vulnerable and need to be protected under phase 2? We need as many people to get those shots to arms, as many as possible and as quickly as possible. So we may have a situation in phase 2 where the government may reconsider bringing forward some of those people in phase 3 to be vaccinated in phase 2 because maybe there's not enough people who have been pre-qualified to be vaccinated under phase 2.